Hello doctors, good afternoon. Welcome back to our classes. Dr. Swarna Balaji online Ayurvedic classes. This is a channel which is made to help our Ayurvedic students and doctors to create more and more easiness in their mind regarding the examination and for the settlement in the clinical point of view also. We'll soon will make more and more updates on our channel. What you have to do is encourage us by like our videos, subscribe to our channel, share our lectures to your friends and juniors so that you will get more and more the best needed topics in our Ayurvedic field. So today's topic is Raynaud's disease. You all might have go through this Raynaud's disease topic. This is a disease which will come in Shalyatantra and it is a arterial disorder. Okay, in the syllabus point you will find this Raynaud's disease in the heading arterial disorders, Dhamani Vikara. Okay, first of all, if it is asked in the examination, because I am saying you this Raynaud's disease, it is a most important topic which will be asked in most of the exam papers. Raynaud's disease is the one which is having its own importance regarding the exam point of view. Definitely there will be a chance to ask this in your examination. So go through this video, it will help to get a good score. First of all, you have to write 6 headings. What are they? You firstly note down the definition. Later on, concentrate on types. Next, clinical features and examination. How you identified that particular disease as an Raynaud's disease. And later on, investigations. And finally, the treatment. In this treatment aspect, you have to cover 3 headings. What are they? You have to write the conservative management and drug prescription, which drugs you will going to give to that particular patient, and later on surgical management also you have to write in your examination. If you attempt all these 6 points in your exam paper, it will give a clean and clear appearance. There will be a good scope to get good marks. So first of all, the definition. Raynaud's phenomenon is a condition which results in a particular series of discoloration of fingers and toes. Okay, you all will see the discoloration in the fingers and toes, hand and leg fingers. There will be discoloration after exposure to changes in temperature. Either it may be cold or else hot. If a person is exposed to such conditions, at that time his fingers discoloration will be seen. In some cases, due to emotional events also, the discoloration will be seen in his fingers. This is considered as a Raynaud's disease. Here, skin discoloration occurs because due to arterial spasm of blood vessels. There will be a spasm in his or her blood vessels which causes a diminished blood supply. Due to this spasm, the blood supply will decrease to that area, and for that particular locality, either it may be hand fingers or else it will be a leg fingers, that is toes, or else any of a single finger, like that. To that particular part, the blood supply will be decreased so that this discoloration will be seen. This is the definition. Mostly 3 colors will be seen: white, red and bluish pink. These were the colors which you will be noticed in such patient who is affected with this Raynaud's disease. We'll see definition clearly. What is it? Raynaud's disease is a condition which results in a particular series of discoloration after exposure to extreme temperature changes, that is either hot or else cold or else due to some emotional events. This discoloration will be seen because of the spasm of blood vessels and which causes a diminished blood supply to that particular locality. This is the definition. Now move on to types. Okay, what were the types of this Raynaud's disease? Primary and secondary. In the primary, symptomless, there will be no symptoms will be seen in that primary condition. This is the first type. It may be associated with any other diseases. Any other autoimmune disease may also associate here in this primary Raynaud's disease. The secondary. In this secondary Raynaud's disease, this can be occur due to any connective tissue disorder. Okay, here in the secondary Raynaud's disease, this is caused due to any connective tissue disorder such as lupus vulgaris or SLE. Now move on to clinical features. What are the clinical features seen? Stage of local syncope and local asphyxia is seen in such patients. And the third stage will be the stage of recovery. In the stage of local syncope, affected part becomes pale. Stage of local asphyxia, here the part becomes cyanosed. In the first stage, it will become pale. In the second stage, it will become cyanosed. And here the fingers will be remain cold and numb. In the third stage of recovery, fingers will become red and swollen. In this third stage, fingers will become red, okay, and swollen. First stage, pale. Second stage, cyanosed. Third stage, red and swollen. Okay, this completes the clinical features. As we have made it a more detailed manner, we have written stages and their symptoms. Next, move on to examination. In the inspection, discoloration of the affected part will be seen and ulceration of the fingertips will be noticed. In the case of palpation, fingers and hands will feel cold. By touching, we can feel coldness of the fingers and hand. Next, move on to investigations. We have to go for arteriography, ESR, hemogram and digital plethysmography with blood pressure determination. Okay, if you didn't remember such a new term, you can write arteriography, hemogram, ESR, RA factor. These were the most common known terms. Next, move on to treatment. In the treatment point of view, conservative treatment is for moving the patient to a warm climate. If it is cold, moving to the hot climate, and tobacco should be avoided. Occupational exposure to that particular coldness or hotness must be avoided by such patient. Drugs. The drugs which were advised were vasodilators, analgesics, anti-inflammatory. Example, pentoxetine. Next, low dose of aspirin also advised to such patients who are afflicted with this Raynaud's disease. Next, move on to surgical treatment. Surgical treatment, amputation is required in the case of gangrene. If there is gangrene formation, gangrene means the dead tissue if it is formed. In such cases, amputation, cutting and removal of that particular part will be done in such cases. Okay, this completes our Raynaud's disease with a clear explanation. We have done with definition, types, clinical features, examination, and in the examination also we have done clearly with inspection, palpation which is needed here in this Raynaud's disease. And investigations, finally the treatment aspect also we have given the all information which is needed for this particular disease. This gives a good appearance for your paper if you present answer in this manner. So what you have to do is listen to this video twice or thrice so that you can write your examination in a clean and clear way. What you have to do is like our video, subscribe to our channel, listen to our videos to get a good concepts. In the future, you will get definitely clinical point of view, medicines and most other important aspects which is needed for our Ayurvedic field. Thank you. Subscribe and stay tuned to our channel.